over the weekend, I worked with a young woman who is a runner and had left knee pain. She's had 2 surgeries in her hips. And I don't think her hips are bothering her anymore. It was for hip impingement, but the main complaint was about the left knee. And it was a good example of how your eyes can throw you off about what the issue is. And generally, under conventional guidelines, physical therapy and training, if someone has knee pain, most people are going to start working on the quad or the hamstring or the knee string, any of those muscles. Very rarely would you think that it's the inability to expand your rib cage while you breathe. So when I first saw her, and I noticed that her left leg, her upper leg, the femur, and the lower leg, the tibia was bowed out. It was pretty externally rotated, and it was more bowed, I guess you could say. And from what I know, that was going to make it very difficult for her to maintain proper foot mechanics. And so I thought, aha, there it is. I mean, that knee's going to hurt because look at that externally rotated tibia. But so I said, you might need orthotics. And she said, I have orthotics. I said, let me see those orthotics. And they were pretty good orthotics. And they're definitely making her walk. They're not for support. They are biomechanically aligning her joints, her big toe, her subtalar joint, which is below the ankle, the talus itself, and the knee can stay in a single line for forward progression without compensation. So she was good in that sense, and her tests were neutral. Her adduction drop test, so her pelvis, I was checking to see whether her pelvis was in the left AIC pattern. It was not. She was neutral. That left leg went down. There was a little bit of tension, but it was neutral. Her horizontal abduction was good, way past 30 degrees. She was limited just barely in shoulder internal rotation. So she was at about 80 degrees rather than 90. And a lot of people, 80 is as good as you're going to get, and I would say they're probably pretty neutral. Her neck was, I don't even remember now. I think it was fine. Otherwise, I would have said something. Or maybe it was limited slightly. It was limited slightly to the right, and her neck was limited slightly to the right, and her leg abduction, her right leg abduction, as you raise the right leg up, that I believe was still limited. So immediately I realized something was keeping her tied to the right side because that cervical the cervical test and right leg abduction, when that's limited, it's telling you that something's just keeping her a little bit to the right, even though when she laid down, she was even though her pelvis was pretty neutral. So testing-wise, she looked pretty good. And so what I did was I had her lay on her side, and so this was her, right? I had her lay on her side, like this, and I just put my hand on her back. So here's her posterior ribs, the left side. And I just put my hand on her posterior ribs, and I said, all right, I just want to see you breathe. And as she was breathing, my hand went straight up to her neck. There it is. If you put your hand on someone's back, right underneath the shoulder blade, around T8 in that general area, and they inhale and your hand and the rib cage moves straight up, you know right away they are neck breathers. They are using their neck to pull their rib cage up to try to get airflow because they're restricted in their rib cage. So right there was really all I had to know. And so all we did was a all fours, hands and knees breathing technique so she would round her back and breathe, and through directing air into her posterior rib cage, it popped those ribs open, expanded that rib cage back, because when you breathe, the rib cage should move back. It should not move straight up. That indicates a neck that's being used, and if you are a neck breather or your neck is overactive, that can throw everything off. So the rib cage has to move back as you're inhaling. That's what that hands and knees position did, and her test cleared up immediately. I would not have figured that out probably a couple years ago. I would have looked at that knee and I would have been thinking hamstring, adductor, whatever. all the muscles, I wouldn't have realized that it was coming from her inability to open up her posterior rib cage on the left that was causing her to not be able to get to the left. So when your pelvis is stuck in a left AIC pattern and you can get it neutral, so you can get it to come back to the center, that doesn't mean, so your testing is neutral at the pelvis, that doesn't mean you can fully get to the left, because fully getting to the left and being able to stabilize on the left side requires that a back on this left side not be arched, not be extended. If it's extended, that means those ribs can't open, and if it's extended, you can't get that pelvis to fully go back and to the left, and then rib cage back. That's true, or the rib cage expanding backwards. That's true left stance. So she was never truly on her left leg. After we did that, I had her stand on her left leg. Her left knee started to feel different pretty much immediately. She felt a big difference in her left knee. There wasn't as much discomfort, and it was really just from opening up her left posterior rib cage, which allowed her to get to the left for real, not fake left stance, real left stance, and breathing in that position allowed her neck to turn off. She still has to work on the breathing aspect because her neck, she's tall, and sometimes tall, thinner people really, the neck breathing phenomenon is pretty pronounced in a lot of them. She's got to keep that left posterior rib cage open in left stance. Now the other exercise that she already has, because she's done PR exercises before, those other exercises will work a lot better. And she sent me an email just yesterday that her knee, on her 2-mile run, her knee feels better than it has in the past 2 years. So the importance of that left posterior rib cage, opening it up through inhalation, cannot be understated. Cannot be understated. And without that being there, even if you get neutral at the pelvis, doesn't mean you're going to be able to incorporate your newfound neutrality properly during upright activity. If you found this video interesting or helpful, could you please like it, share it, subscribe to the channel, do anything you can to spread this information, because PRI is really changing people's lives, and I hope to share it with even more people. Thanks.